What is going on with Kylie Jenner's under eyes? So you can see here, she's got a significant puffiness just around the eyes here. And I can't help but suspect that she's had a little bit too much filler in that area. I wouldn't want to be her injector at the moment. I'm sure they are seeing this all over the internet. It'd be very embarrassing for both of them at the moment. Now, the under eye region has a very delicate set of lymphatic channels. So lymphatic channels are the things that clear away toxins, clear away fluid from the under eye region. They've got very thin walls, these channels, and any bit of pressure at all is very likely to cause a blockage and to cause a buildup like you see here. And you can see a very discrete line here. It's called the nasojugal fold. And there's a very discrete swelling. And I'd imagine that there's a little bit too much filler placed, or it's been placed in the wrong area that's caused a slight blockage of those lymphatic channels and causing that filler to look a bit puffier than usual. The other thing here is that Kylie Jenner is a very successful young lady, and I'm sure she's jet setting all over the world. She's probably flown in on a 15-hour flight, had no sleep, and then has been thrust in front of the camera for this Paris Fashion Week. That, coupled with filler placed in the tear trough region, could cause a swelling like this. Now, what can she do about it? I would suggest, if Kylie was my patient, we would do a little bit of dissolving agent there. If this was indeed filler, which I suspect it is, we'd do a little baby micro reversal and we'd smooth that area out very, very easily. This would be a 2-minute treatment with absolutely no downtime whatsoever. Now, I've looked at a lot of the comments that have been on these posts, and a lot of people are saying that Kylie looks older. And I think the main reason she looks older is that putting a lot of filler in your face, that's typically something that people do in their 30s and 40s. As you get over your 30s, you start to lose at least 1% of your collagen every single year. So that gives you a volume deficit, it gives you a hollowing, and a lot of people will go and fix that with filler. Now, it's very easy to go slightly over the top. So that slightly overfilled look that you see is typically in people in their 30s and 40s. And that's why I think that people are saying that she looks older than she is. But in saying all that, we're all human. Her injector's human, she's human. So I think all that's left to do here is just do a little bit of dissolving agent here, and Bob's your uncle.